All right, everybody. Gonna get into it today. Nothing to it but to do it. So today we're going to talk about anticonvulsants, which is another way of saying these are seizure medications. So these are anti-seizure, anticonvulsants. Some different labels again, different textbooks, different depending on who you talk to, some different labels. But I usually use anti-seizure, anticonvulsants. I don't know. I use them interchangeably. Let's get into it. So just a background for you guys, you'll probably be getting better definitions in pathophysiology and ICM, but just to make sure everyone knows what seizures are. So it's an involuntary movement and sensations. A lot of your patients who do have seizures need to be on usually more than one therapy. So sometimes they can be treated with monotherapy, but a lot of times it's a combination. It's really going to be patient specific. There is sort of an art to treating seizures. But I'm going to go through some specific ones and classes that are good for specific types of seizures. The other thing too is that there unfortunately is an increased risk of suicidal behavior or ideation. So there was a special alert from the FDA in 2008. I'm sorry. So it is something to think about and something to with your patients who are on anti-seizure medications or anticonvulsant therapy. So here is here's a way to classify seizures, and again, I would definitely refer to how they classify them in ICM and pathophysiology for their, but for pharmacy here, these boxes here, my wife used to give this presentation, so she boxed these for some reason. I don't know why they're boxed. Ignore the boxes, just erase those. But we basically have partial, aka focal seizures, and then tonic-clonic, also known as grand mal seizures, and then the different subtypes under there. But this table, for me, for testing purposes, you don't have to worry about memorizing these or these origin and features. This isn't stuff I will be testing you guys on. This is just maybe help with ICM. I don't know. Here's an overview, mechanism of action. We're going to go through these more specifically, but this is a good, or for me, I'm visual, so I like this for helping me remember mechanism of action. So you'll see these drug names here, 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 here. And those are the ones that I know very helpful, right? Here. Oh, but anyways, drugs, and this is showing where they have their anticonvulsant properties or related to mechanism of action. So hopefully this will help you guys memorize mechanism of action. So first off, we have these drugs that are used to treat partial or generalized tonic-clonic seizures. So for classification purposes, I've had students in the past ask me what I would like you all to do. So two things, sorry for asking you for two things, but I'd like you guys to know these categories, but then you'll notice, hopefully pretty quickly, you look in here, phenobarbital is in this list, but then it's also a barbiturate, so a couple classifications, and it's also noticed here, phenobarbital pops up again to treat status epilepticus. So I know it's annoying and it's not my favorite thing to study, but just please, unfortunately, these again, you'll see these kind of things on board questions and on your rotation. So I want you guys to be prepared for that. That's my motivation. But yeah, if you could look at those, and another one's jumping out too. Like we have the benzodiazepines here, clonazepam, diazepam. They're in a few different categories. You see them in different sections and stuff. But go ahead and look at this. Pay attention to this. It is important, as with all of my exams, that you guys are able to properly classify these medications. And yes, that means sometimes knowing that these drugs are in more than one category. First, we have phenytoin and fosphenytoin. I put the brand names here just because I hear the brand names a lot for these anti-seizure medications, but not on the exam. So those are in all caps of brand names. That's just their FYI for you guys. Kinetics here, don't worry about it too much. Other than just the fosphenytoin is usually parenteral, so you don't give it a PO. It's that. So they are metabolized in the liver, and definitely put a star by here. Drug interactions. I want you to definitely, anytime you see phenytoin or fosphenytoin, I want you guys to be thinking about drug interactions. So this top part of the kinetics don't really worry about, but definitely put a star here. Many drug interactions. So it's like, phenytoin, Coumadin. Hopefully you guys are getting a pattern. There's certain drugs that you have to worry more about drug interactions than others, and definitely the phenytoin, fosphenytoin, definitely stuff you'll see on the exam, board exams, etc. It's popular. And then definitely your patient population. Anytime you see phenytoin on someone's patient profile, I want you guys to almost have a kind of a, reaction, reflex, a reflex where you see phenytoin, think drug interactions. Mechanism of action here, noticed that phenytoin is listed here from that diagram I showed you earlier, that image I showed you earlier. This basically blocks sodium channels. So it's a sodium channel blocker, and that is what it's doing, and specifically in the neuronal membranes. With infecting your nerves. Uses, it's on that other table, but so it's used for seizures. That's what we're talking about it here. And then phosphonatoin IV is used in patient settings to help control seizures. Adverse effects. So these are important, as usual. Want you guys to pay attention to these. CNS adverse effects, more common and cause some problems for people. The sedation's one, especially if outpatient with a phenytoin. If a patient's naive, that will be one that we'd like to warn them about in the pharmacy. Maybe watch out. It can cause some drowsiness if you're not used to taking it. The liver involvement here. It may warrant, depending on how long the person's on the phenytoin, let's say, it may warrant that you have to supplement them with vitamin D. And I don't have the specific recommendations on the vitamin D supplementation. I'm sorry about that. But yeah, so just go based on their, the general dietary recommendations for vitamin D. Also note too that the patients, or the humans, not just these patients, but they can get vitamin D from sunlight exposure. So they're no sunglasses, no sunscreen, uncovered skin, and it's at least 15 minutes. It kind of depends on your skin color and how sensitive you are to the sunlight or whatever. But so usually it's 15 minutes is what they say. You can also get vitamin D that way, and then there's supplementation. Rare but serious, we have the gingival hyperplasia and SJS, Stevens-Johnson syndrome, especially in Asians. You have to be concerned about that one. That population more so. There's a generic variation there where they can be more sensitive to having this SJS reaction. So these two here, rare but serious. And again, ones that you probably will see on your board. So here's some visualization of this SJS, really bad reaction. You probably heard about it and learned about it in ICM, I'm assuming. And then the gingival hyperplasia just means an overgrowth of the gums. So we have an image of that there. Other adverse effects too, hirsutism, which is abnormal hair growth or again, kind of rare but serious, and people don't like too, having hair growing where they don't normally have hair growing. The folate deficiency, again, another reason why the patient may need to be on supplementation while they're taking this. Again, if it's longer term, because they can have problems with anemia. So vitamin D and folate potentially with this one. Teratogenic, put a star there. Definitely something to think about with your pregnant patients. And then rare but serious atypical lymphocytosis. Phenobarbital. So we talked about this before a couple different times now, but also with categorization, I want you guys to be thinking about it for seizures. Mechanism of action we've already been over, but just, so GABA is the main thing that's involved there. Used for seizures. So it has some labeled uses and unlabeled uses or off-labeled uses. So, and honestly, at least from my experience practicing pharmacy in Texas and Oklahoma, I've actually as far as dispensing phenobarbital, the majority of time that I've dispensed it is actually for seizures. Like I said, it's not as popular as it once was for anxiety medication. So, again, my limited experience isn't, I don't know if that they do in other parts of the country, et cetera, but typically dispense phenobarbital for seizure disorder. So that may be something that you guys will be prescribing it for. It is a controlled substance, but it's not a C2. So this is something that PAs can prescribe. So this may be part of your toolbox, so to speak, when you are trying to treat a patient with seizures. Adverse effects, we've been over this before, but definitely look at this again. This is a review. I'm not going to spend too much time on it here, but definitely look at this. And make sure you know the adverse effects, because they are a pretty big concern with phenobarbital. So we have primidone here, brand name there. This is usually an adjunct medication, usually used in combination with some other things. Not super popular, you may see it, but anti-seizure medication. Carbamazepine and Oxcarbazepine. They're very chemically or structurally related. So I'm not going to, when pharmacy school, we had to learn all the structures and stuff, and I still have PTSD about all these organic structures, so I try to keep them off. But I guess this would have been a good instance to show you that just if you want to look it up, some people like chemical structures, not me, but you can look it up, and they are similarly structured. So they are similar. They're also structurally related to the imipramine and then other tricyclic antidepressants, which is just something right now. It's just FYI, but it is something we'll talk about more in the psych module. And then it's also related to that too. Well, let's go to the mechanism of action first, but before I get sidetracked, I'm talking about psych stuff. Mechanism of action. So you can see here listed here again, same as phenytoin. They are sodium channel blockers, and then that helps inhibit the firing of the neurons. Uses, so they are popular, or you do see them used for seizures, which is why we're talking about it. I keep trying not to laugh because it's the title of the presentation, so I kind of feel silly saying this is a seizure medication when they're all seizure medications. But anyway, so just bear with me. I'm sorry to keep saying that. But they have some other uses too here. You'll notice that neuropathic pains and neuropathies, you sometimes see it as an adjunct with some other pain medications. Well, we're going to talk about it again in the psych module, which I was going to say earlier. These are used for bipolar disorders. And sometimes in combination with other things, whatever. We'll get into all the details of that. But so these are ones that, for categorization purposes, they're going to be seizures. We're going to talk about them. They're going to come up with in the musculoskeletal module, and then they're going to come up again in this psychiatric module. So again, try to hopefully connect the dots and kind of think about these a little more globally. But for this module, they are seizure medications, right? Anti-seizure medications. Adverse effects. Got the most common ones listed up the top. The let me say it again. Wait one sec. Diplopia. All right, everybody. It's not okay. Diplopia. I don't know why I had trouble saying that this morning. Which is also known as double vision, or lay public. So double vision, and then ataxia, which is impaired coordination. So impaired balance, coordination, trouble, with movements, etc. But which can be, they're common, unfortunately. Patients don't like double vision. I mean, there's that awesome song with that double. No, I'm not going to sing for you guys. Double vision song, but patients don't like it. It really freaks you. I don't know if anyone's ever had double vision, but it's really freaky. It's not fun to not be able to see when you can see one day, and then and then the ataxia too, especially a concern with elderly population, something to be concerned with, and it's because of risk of fall, etc. And again, but no one likes that, right? Also, you have to worry about drug interactions with these. So put a star by that. Want to make sure you guys know that because of its effect on the liver. And then aplastic anemia and agranulocytosis, rare but serious adverse effects. And because of that, we need to monitor CBC. So put a star by that. That's important too. But most common here, we have the double vision and ataxia. I was going to try to say it again. I don't know. I can't. I just think of another. I'm not going to tell you guys because I always think of something else and it throws me off and I can't say that word. But I don't want to tell you guys that because then I'll just throw you guys off forever. It's like getting like a bad song stuck in your head, and I have this song stuck in my head all day, and then you tell somebody and they're like, great, thank you. Now I have that song stuck in my head. Thanks for ruining my day. So anyway, so Diplopia. I got to slow down when I say that one so I don't say it wrong. But usually the good thing is you'll hear other physicians, physician assistants, other healthcare practitioners say this, but with patients you can just say double vision. They appreciate using plain language. But anyways, all right, now we have valproic acid and divalproic sodium. So again, if I was into chemical structures, if that's something that I was into, I would show you these are all chemically related, structurally, so to speak. You can kind of tell by the names too. They kind of have similar sounding names. The brand names are all very similar, so definitely don't get those confused or get those mixed up. I actually stick to the generic. Well, these are all generic now too. They don't make or their generic equivalents rather. They have, but there's practitioners I know like Depakote, for example. That's one that's popular. People usually say Depakote. I think part of it because it's shorter and is easier to say than divalproic sodium or divalproic. And then in pharmacy school, everyone thought I was hilarious when I wasn't trying to be funny. So before going to pharmacy school, I'd never been in a pharmacy or never shadowed or worked in a pharmacy, and luckily never had a lot of prescription drugs or anything, just, antibiotic when I was sick or whatever. So there was this case presentation, we were in lab, and I had to read it. It's like, oh, so-and-so presents to the pharmacy, blah, 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 whatever. And then I said Depakote, as the drug name, and everyone just started laughing. There was a pharmacist there. They just thought I was like trying to be funny, but I didn't know how to say that. So it's pronounced Depakote. It's not pronounced Depakote, is what I thought it was. I thought you pronounced the E. I'm like, why is there an E there if you don't pronounce? But anyways, so yeah, they're like, where are you from? You're like a hillbilly or whatever. I'm like, Depakote. No, but yeah, it's Depakote. So I will forever remember being laughed at and super embarrassed and in lab. I was like, I hate everybody in lab now. Why are you making fun of me? No one's ever said that word to me. But anyway, so English is hard, right? English is in another language like Spanish, you pronounce every letter. All right, I'll get off my soapbox. Sorry. All right, mechanism of action. Again, this is an involved GABA here. You'll see it right here, valproic acid. But basically, the increased concentrations of GABA will then help suppress the firing of the neurons. So notice there's kind of a theme there. This also blocks the T-type calcium channels. So a couple of things there with mechanism of action. Uses, a lot of different uses for seizures, obviously. A couple other uses that we will see in other modules. So it can be used for migraine prophylaxis or sometimes as an adjunct for people who suffer from migraines. And then bipolar disorder, again, mood stabilizer. So these are going to be ones that are like the carbamazepine, mood stabilizers / seizure medications. Adverse effects. Unfortunately here, rare but serious. Here, liver failure, so hepatotoxic. Definitely put a star by that. I want to make sure you guys know about that. Unfortunately, too, is more pronounced in your pediatric population. So that is something. Doesn't mean that I've had students in the past ask me, oh, so don't worry about it with adults. No, it doesn't mean that it can't happen with adults and you don't need to be concerned about it. So for testing purposes, for your boards, for life in general, please think about it or associate these drugs with being hepatotoxic. Other than that, CNS effects, so drowsiness, dizziness, are a concern and more common, unfortunately, or can be. And so again, maybe the drowsiness stickers on your bottle there. And then GI adverse effects, so nausea, vomiting, upset stomach, all that good stuff. Also, too, please put a star here. I mean, definitely read through everything, but put a star here. They are teratogenic, so that's definitely ones I want you guys to know about. So it's good stuff there. All right, adjunct drugs. So these are used in combination with other medications to treat seizures. Vigabatrin, brand name is Febrile. This one can help. It works via the by potentiating or increasing the concentrations of GABA. Gabapentin is also brand name Neurontin, pretty popular seizure medication, but then it's also popular, and I see it prescribed a lot for neuropathic pain, so neuropathies can help with some of those, RLS as well, and neuralgia. So this is one too, we'll say again in the musculoskeletal module, but can be beneficial for seizures. Lamotrigine, brand name Lamictal. This one works via the sodium channels again, and please refer back to those visualizations. I think those will help you guys keep all these mechanisms of action straight, because there's a lot. They kind of seem random, and there's a lot of ones going on. But anyways, another one too we're going to see in the psych module. So mood stabilizer and seizure medication. Put a star here by the box warning. You do have to be mindful of skin rashes when a person's on this, and maybe warranted. May warrant the discontinuation of the medication, because unfortunately there is a risk for SJS, and it's a really bad. It's a really bad skin reaction too, and really bad. Like I said, I think you guys have probably learned about it already, but I would definitely look into that and read about that a little bit more. But it's a very bad skin reaction. CNS depression, that's one of those common adverse effects, and again, something that we warn about. Don't operate heavy machinery with this medication. And then rare but serious, the aseptic meningitis, unfortunately, is something that can be seen with that. Then we have Gabatril, which is tiagabine is the generic one. Also an adjunct, not super popular, but this also affects GABA here. Felbatol. The Felbamate is the generic there. This is one of those medications that the mechanism of action is not fully elucidated, so they don't know exactly how it works, but it is used for seizure medication. It is not very popular and should be used rarely, because unfortunately it can cause aplastic anemia and hepatic failure, so hepatotoxicity. So anyway, so yeah, usually not super popular, an adjunct medication. And related to that too, please note that there is a boxed warning against the aplastic anemia and also a boxed warning for the hepatic failure. So so be cautious when you're using this and prescribing it. It's not very popular. Anyways, this is just an FYI slide. Don't worry about this as far as testing purposes for me. Here we go. Levetiracetam, which it's a lot easier to say Keppra, and usually people say Keppra as a brand name, or I hear that a lot more. Another mechanism of action that's not fully elucidated. Another medication you can categorize as having psych applications as being mood stabilizer and also adjunct seizure medication. Zonisamide, Zonegran is a brand name. There are a lot of Z's there. Mechanism of action, so this one is going to work. Oops, what did that happen there? Okay, this one works both on sodium and calcium channels to help reduce seizures. Adjunct, and this is another one that can be used for mood stabilization. Adverse effects, the big one you have to be concerned with, rare but serious, but metabolic acidosis, and then more specifically in pediatric patients. Topiramate, this one is Topamax is the brand name. You usually hear the brand name too. Sodium, again, affecting the sodium channels here, but also has some effect on GABA. This one has a lot of different uses. Notice it has migraine prophylaxis as well as seizures, and then also unlabeled uses neurovascular pain, some headaches, spasms too. So you see this one popping up: inpatient, outpatient, psych hospital, etc. Adverse effects. So common adverse effects here. We have here drowsiness, dizziness, so CNS adverse effects, and then the movement disorders, the ataxia. And then unfortunately too, they can increase the risk of cleft palate. So that is something to be mindful of with your pregnant patients. All right, next section here, absence seizures. Ethosuximide or Zerontin. This one can help with seizures, but works primarily calcium channels there. Usually well tolerated, just a little bit of CNS and GI adverse effects you have to worry about. Other ones too, we've talked about valproate already, but so you can just hit a couple different classifications there. Clonazepam we've also talked about. This one, it can be inappropriate for long-term therapy because of tolerance. Remember that from that other lecture on the anxiety medication. So maybe just an adjunct and maybe temporarily, just to kind of bridge a patient until you find something better that works for them. All right, status epilepticus. These are very serious emergency instances. So we have the drug of choice are going to be IV benzodiazepines, specifically the diazepam and lorazepam. Other ones here, go ahead and list these listed here. Notice another benzodiazepine here, midazolam, but not first line, and the phenobarb. Pregnancy category. So this was, it's in here. I left it in here, but it's out of date. So the FDA has recently updated their pregnancy categories. I still like to include the pregnancy categories for you all because a lot of practitioners still will refer to them, and a lot of textbooks, etc., will still refer to things as being a pregnancy category X, for example, pregnancy category C. So I don't know if this new system is going to catch on with the FDA. They're trying to make it, and long story short, I will give you guys the new classification system, so stay tuned. It will come up in the OB-GYN module. We'll go through the new categories and the old categories again. This is here just the old categories. You can read through them. They're good definitions, but definitely pay attention to this one, this slide here. For categorization. So this is good here for the category D, and then just category X. So good summary table here. I like these, so definitely go through and read through this. Clinical applications, adverse effects, pay attention to those, and contraindications. Make sure you look through those. And I don't think we've talked about the MAO inhibitors yet, but that's a type of antidepressant. So just know that that can be a concern there. I won't put drugs on the test that you guys haven't seen yet, but we will be learning the MAO inhibitors during the psych module. So please read through those. Oh, you'll notice here too, sulfonamide hypersensitivity. Again, the zonisamide is chemically structured close enough to the sulfonamides, or it has a sulfonamide within its chemical structure, that you do need to be concerned about that. So that is one of those it's a theoretical concern, but still for board questions, testing purposes, still need to be to know that as a contraindication. Same thing here, good summary. Manage the seizures here. This can just maybe help you guys with ICM, hopefully. But anyways, just go through. These are good. I'd read through these. Make sure you look through these as far as first line, second line. I think they may help you on your rotations as well. So that is the end of my presentation. I just have to leave you guys with this Double Vision song by Foreigner. It's going to be stuck in your head all day now. So you're welcome. I'm sorry. You guys can send me hate mail if you hate this song. I just I always think of that when I hear Double Vision. But anyways, talk to you guys later. If you have any questions or comments or anything, please email me. And no, I'm not going to stop the song. I'm going to keep letting it play. But yeah, just email me as always if you have any questions or anything. Or if you want to buy the Foreigner album and you're just having trouble locating it, reach out to me. Maybe I have an extra copy lying around. No, I'm kidding. All right, you guys have a good one. I'll talk to you all later.